We're here with Mr. Borowski. If you want to go ahead and introduce yourself, what you did, what you do currently, all those things.
Okay, I'm Mr. Borowski. I'm an athletic trainer by trade, also a licensed physical therapist assistant. I've taught and been an athletic trainer in Capel since 2000. Now I just teach and do that on the side.
Okay, and in your years of working, how does nutrition play a crucial role in managing and preventing type 2 diabetes among athletes?
When I was an athletic trainer, we used to counsel athletes on nutrition for performance, which is making sure that they had the right fuel in their tank to keep the engine moving so they would perform at their peak performance. With diabetes, it's more of a health issue, so we have to monitor their blood sugar levels because they're not able to do so on their own. So we would make sure that they test their blood sugar before, give a reading, and then we would plan their snacks and such so that they would eat before they worked out so that they could keep a steady level of blood sugar so that they wouldn't crash or have other problems.
Yeah, and what are some dietary considerations that you would have with athletes with diabetes or just in general?
Okay, most of the time they're going to be dipping low on their blood sugar, so we would make sure that they had some sort of juice or some sort of glucose of some sort, like 20 minutes before they exercise, depending on what their blood testing was when they would test their blood, and then check it again afterwards. And then for every athlete, I recommend a recovery drink of chocolate milk because chocolate milk has the right combination of carbohydrates to protein stores so that it would help them level that back off as well after they work out.
Okay, and then what are some other meals or snacks that would help regulate blood sugar levels?
Again, anything with sugar in it, so fruits, fructose, any kind of complex carbohydrates. I mean, in a pinch, they could eat chocolate or candy or something like that, but that's in a quick fix. You want them to eat more complex carbohydrates in their diet, so the pastas and things like that would help with that. But you want to have that quick energy for them so that they maintain their level. But during their diet, then you want to get switched to largely complex carbohydrates because their body takes longer to absorb them, and it's better for their health.
I am right. And then, what are specific supplements or dietary strategies that you would recommend for athletes that are struggling with diabetes or would like to prevent diabetes?
Specific diets. I think diets in general are something you gotta be careful with because if you're trying to diet to lose weight, up and down and up and down. So really, you look at having a breakdown of your carbohydrates, proteins, and fats. Usually about 60% is what we say for carbohydrates, 20 to 25% fats, and then 15% protein is generally what we do. So you look at it, there's a number of apps that they could use. They could use MyFitnessPal. They could use other things that would help them track their food and just maybe counsel them on what foods are better than others, and they can look at the dietary composition of the food to make sure that it fits with their dietary requirements. Because of exercising, they need more calories, but they want to make sure that the composition of those calories are appropriate.
And then lastly, what are some common misconceptions or challenges that athletes face when it comes to managing both their athletic training and their nutrition?
As far as in related to diabetes?
In diabetes or
Okay.
in general?
Because diabetes is a lot like asthma because if they're controlled, athletes can perform at very high levels, okay? So the problem with dieting, sometimes they want to gain weight, so they eat really heavy proteins or they use heavy vitamins and things like that. Well, the vitamins just become expensive urine. Their body can't absorb that extra. And same thing really with some of the other stuff. If you are grossly out of proportion with your diet, it's going to stay in your body as fat. So you want to increase a little bit of your protein maybe, and then exercise, and then also keep your carbohydrates. Yes, your carbohydrate stores up to a certain level. So diets themselves don't work. The composition of your diet is really what we have them focus on.
All right, and that's about it.
All right,
Thank you.
perfect. Yeah.